all New Zealanders. When we came to government, we made a very clear commitment to deliver a health system that truly works, one that is much more accessible, more responsive, and more focused on the needs of patients. We promised to prioritise frontline services to deliver the care that Kiwi families rely on every day, ensuring that New Zealanders get the timely, high-quality treatment when and where they need it. Today, we're taking another important step towards delivering on those promises. As part of Budget 2025, our government is investing $164 million to expand urgent and after-hours healthcare services across New Zealand. This investment will mean that 98% of Kiwis will have access to urgent care within an hour's drive of their home. We're ensuring that families in Whangarei and Auckland and Tauranga and Palmerston North, Dunedin and other major centres have access to 24-hour urgent care services, so that when a child's fever spikes in the middle of the night, parents have somewhere to go without delay. We're strengthening services in places like Invercargill and Timaru and Lower Hutt, so that when an elderly person suffers from a fall, they won't have to be left waiting in pain. And we're also ensuring that better after-hours services in remote rural communities with 24/7 on-call support. Because if you cut your hand on the farm or your asthma flares up late at night, you shouldn't have to drive for hours to get help. This is about action. It's about restoring faith in our healthcare system and making sure that patients come first. And with that, I'll hand over to Simeon to give you a little bit more of the detail. Thank you.
Thank you, Prime Minister. Every day around 5,000 New Zealanders rely on urgent care clinics. Yet in many parts of the country these services simply aren't available after hours. That's not acceptable, and the government is changing that. This $164 million investment will significantly expand services, access to urgent and after hours care across the country, easing pressure on our emergency departments, improving outcomes and giving people care closer to home. This includes a new 24-hour urgent care service identified in Counties Manukau, the only part of Auckland that doesn't have a current 24/7 urgent care clinic. New services identified for key provincial centres such as Whangarei, Palmerston North, Tauranga and Dunedin. New and extended services identified for places like Invercargill, Lower Hutt and Timaru, and stronger after-hours support for remote rural communities. We'll be working with our hard-working frontline workforce to ensure that we can deliver these services for our communities. As part of this announcement today, it builds on the wider work we're doing to strengthen primary care, including 100 clinical placements for overseas trained doctors, recruitment incentives of up to 400 graduate nurses annually for 5 years to work in primary care, 100 additional doctor training places each year over the course over this government, up to 50 graduate doctors training places in primary care annually, up to 120 training places for nurse practitioners in primary care, accelerated tertiary education for up to 120 primary care nurses in primary care, and $185 million uplift to funding for primary care over 3 years. And also better access to 24/7 digital care services for all New Zealanders starting from the middle of this year. We're delivering a comprehensive long-term primary care package that puts patients first and ensures that all New Zealanders, no matter where they live, have access to the timely, quality health care that they need. New Zealanders deserve to know that help is where they need it, and it is in their communities. And with that, pass you back to the Prime Minister.
All right, guys, firstly, happy to take any questions. Away we go.
Prime Minister, thank you. Where is this $164 million coming from? Is it new money or rebuild?
It's new money. Yeah.
New money is part of the budget.
I'll let someone talk about it.
This is a new budget initiative on top of cost pressure funding. So as you'll be aware, in last year's budget we pre-allocated cost pressure budget funding over 3 budgets. This is a new initiative on top of that funding, so that we can expand access to primary care and ensure people can get that care closer to home.
Minister Brown.
Look, this is primarily about expanding access so that we have a more consistent access across the country, particularly in those parts of New Zealand where they don't have those 24/7 care clinics at the moment. It's about removing that pressure on our hospital emergency departments. Around a third of patients who turn up to Our hospitals are acuity level 4 or 5, which basically means they could be seen in primary care. And also it's about having a consistent framework. We will remain, funding will continue to flow for those patients on community services cards and those patients who need it, and also those lower payments for people with children, which is really important so those parents with children can get the care they need for their children. Look, there'll be a more consistent framework around co-payments across the country, but we're very clear, we're focusing on targeting to those who need it the most. That's what we're very much about doing in primary care, so community services cards, free access for children at primary care with their GP for under 14s, the very low cost access scheme which supports primary care in those high deprivation communities in New Zealand. We're about focusing and targeting that money to the people who need it the most.
I think the other thing I'd say is that we're also trying to join up the primary care with the hospital care system, because as you know, our emergency departments are under huge strain. We've got a major set of targets to make sure that we can actually treat people quickly through an emergency department. And it's not helped if we can actually get people treated closer to home, obviously take that pressure out of the ED. Obviously the cost when you send someone into an ED, it's probably closer to about $800. When they use an ambulance, it's about $1,000. So actually, for us, this is like a really smart investment to make sure that we can meet people's needs where they are closer to the home, and obviously stabilise the existing services and expand into some of the new urgent care services and after hours as well.
Look, we're going to work with existing providers as much as possible. That's really important. And so Health New Zealand will go through a contractual negotiation process to set these up as quickly as possible. But ultimately, just like this clinic behind us, it used to be a 24/7 clinic and unfortunately had to reduce its hours due to a lack of funding. This will support services to be able to then expand those hours and be able to provide more in those communities. And so we're really clear we need to work with primary care providers so we can expand it as quickly as possible. But it also goes alongside all of those initiatives that I spoke about, which is about expanding our health workforce in our primary care facilities. And that's where, more doctors being trained in primary care, those overseas trained doctors who are unable to work here, making those placements available so they can actually start working in primary care to provide care for patients. The 400 nurse placements every year into primary care, and it's $15,000 payments to primary care facilities in urban environments, $20,000 in rural environments. So we're also recognising that there are different needs in different parts of the country, and the package as a whole is designed to support that care, and as the Prime Minister said, keep people out of hospital and keep them well in the community.
Minister, do you have any expectations when the first clinic will be?
Well, we've outlined in the framework that the first 24/7 clinic will be the one in Counties Manukau as the first one. The second one is in Dunedin, and then next year the focus will be on Tauranga, and the year after will be Whangarei and Palmerston North. If we can bring those timeframes forward, we absolutely will.
When you say these services have been identified, what does that mean?
Well, that Health New Zealand's gone through quite an extensive process putting together a urgent and after hours care framework. So it's looking across the country of what the need is and what the type of response that's required. So in our major urban environments, in our metropolitan environments, that's where that's been identified. Overnight care is most suitable, so we can take the pressure off the hospitals. In the more regional towns, such as Rotorua, it might be to 8 o'clock or 10 o'clock at night. And then in remote communities, it's going to be more of an on-call type service arrangement. And a big part of that is this is about strengthening those primary care workforces, providing extra funding, strengthening those workforces so that they're able to respond. And particularly in our rural communities, where often at the moment it's the GP who's on call 24/7 and then has to see the patients during the day. If we can strengthen that network of support so that those GPs aren't the first port of call, we can actually really strengthen our rural primary care practitioners and provide better care in those communities.
These services that you've identified, are they probablys or definitely's?
These are definitely's in terms of we've outlined the 5 24/7 locations in terms of the cities that require the investment. Obviously there's a procurement process that Health New Zealand will go through to then contract with those providers and have those services established. Well, that's why we've got not just this investment today, which is around investing more in after hours and urgent care, but all of those other initiatives designed to invest more in our workforce in primary care. So 100 overseas trained doctors who are unable to get practicing certificates, having them get their practicing certificates in primary care, a primary care pathway for doctors wanting to go straight from medical school into primary care. It's also about those nurse practitioners that we're going to be investing to have 120 nurse practitioners able to start their careers in primary care. These are all about establishing but also strengthening that workforce so it's able to deliver more and ultimately keep people out of hospital, keep them well in the community and provide that care closer to home. Yep.
Well, the first thing I'd say is that whether you're in the funded sector, the private sector or the public sector, any individual, any union is entitled to make a pay equity claim under the new laws. We expect that there will be pay equity claims, that's why we've set money aside for that. But with respect to the funded sector, we'll look at those as they come through case by case, and obviously the government and those government agencies that are supporting the funded sector, they'll look at funding that through budget bids in the future. Yeah, absolutely. They'll be looked at on a case by case basis. Yeah.
Could you comment on the polio outbreak in Papua New Guinea?
Well, I mean, I'm sure Simeon will have some more to say for it, but I mean, what I would say is that that is something that we are monitoring very closely. I know Simeon's team are looking at that through wastewater analysis in particular to see whether that's, we monitor that very closely. But I just think when you hear about the polio outbreak in Papua New Guinea, when you hear about a measles case in New Zealand last week, it's a very, very good reminder to everybody watching, as parents in particular, to get your kids immunised. These are your children. We want to make sure that under 2-year-olds we lift the immunisation rates tremendously. We've made some great progress since we've come to government, working with iwi providers, working with other health providers. We've lifted it, I think, 5 or 6 points up to 80-81%, but we know we need to be closer to 90% on immunisation rates for our under 2s in particular. It's why it's one of the 5 big goals that we have. So in a first world country, we don't want to see measles shutting down schools and shutting down a country. And I just say to you, when you're a parent, I've spoken to a couple of parents who hadn't immunised their children and they end up with whooping cough. There's nothing we can do for that baby at that point in time, for a period of time. We just hope that they can fight it. And I'm telling you, parents have a huge amount of regret at that point in time about having not got their immunisation. So if my one ask is, I just would say all of us have a responsibility, if we've got kids, to get them immunised. I just want to say that very, very strongly.
Has New Zealand offered any aid or assistance?
We'll look at that as it comes through. Obviously, Prime Minister Marape is a good friend of ours. He knows to reach out to us if there's anything we can do to help, as we've done before, as you saw with the landslides. We're there to help Papua New Guinea in any way we can. And so we're there to help Papua New Guinea, but I think the lesson for all New Zealanders is get your children immunised. No, not at this stage.
Just going back to pay equity.
Yeah.
So obviously you're saying it's it will be decided on a case-by-case basis funding the funded sector. Say the case of funding, they will the government be involved?
Well, again, I'm not going to speculate, but I'll just say to you is that there are obviously some organisations that the government funds a large proportion of the funding, and obviously those are things that the others that we fund a relatively small contribution. So we'll look at what I'm saying is anyone in the funded sector or any other sector, public or private, can make a pay equity claim under the new laws. We expect there, sadly, to be settlements that will be needed. The government will look at the funded sector on a case-by-case basis, and again, if there's any more funding needed to support that, we will look at that and fund that out of our future budget bids as well. Well, it's what I've been saying last week. No disrespect, but Labor, the opposition, the unions, they all want to be. They've been scaremongering on pay equity since we introduced this legislation, and pay equity is critical to New Zealand. It's enshrined by this government. It's committed to by this government. Yes, we're changing some of the criteria to make it more workable, given what we had inherited was unworkable. We want to make sure it's robust and sustainable. That's why we've made the changes we have. But that's our position. The funded sector will look at on a case-by-case basis, as you could well understand, given the nature of the organisations we're talking about. But equally, anyone, any individual, any union can launch a pay equity claim against their employer as they wish. No, I think No, I think, as I said to you, there's nothing stopping any individual or union launching a pay equity claim. This is a government, and the National Party in particular, that's been at the forefront of pay equity. We are committed to it. All we're doing is bringing the legislation back to what was intended in 2017 to make sure that it is workable, so that we can actually meet those obligations, and it is affordable and it's workable. That's the problem that has happened over under the last administration. So we're fixing it up, like we do a lot of things that we inherit from Labor, and as a result, I just encourage anyone and everyone to launch a pay equity claim under the new laws if you wish.
Thanks very much, everyone.
Thank you, team.